Hello everyone, I'm Dr. Y. Coney and welcome to Bright Star Baby and Child Clinic. In this video, I would like to address an issue that is seen commonly in newborns, which is crying and having colic in infancy. Now, newborn patients, their parents will come in and ask me, "Doctor, why is my baby crying so much? She looks like she's in a lot of pain. Is there something that I did wrong? What can we do to help her?" So today we will address the issue of why do babies cry, what is colic, and also how do we manage colic. Let's go to the first question. Why do babies cry? Please bear in mind that it is very normal for newborn infants to cry, especially in the first 3 months. I would tell parents to expect them to cry rather than they don't cry. So expect it rather than not. Crying serves several purposes for your baby, and they are useful purposes. It's the way that they get attention, especially when they're hungry or feeling uncomfortable. It also helps to shut out sights and sounds and other sensations or stimulations that are too intense for the baby. And it also helps release the baby's tension. This kind of fussiness or crying helps to get rid of excess energy so that the babies can return to a more contented and calm state. Frequently, after a bout of crying, babies will appear calmer or even sleep after that. The next question is, does your baby have a crying period each day and you feel like you absolutely cannot comfort or console your baby? Welcome to parenthood. One of the first hurdles of becoming a new parent is something called colic. Colic is very common and usually happens in the late afternoon or evening time. Sometimes it occurs at night as well. In the past, it used to be called the witching hour. Now, what is colic? Colic is a frequent, prolonged, and intense crying or fussiness in a healthy infant. Remember, healthy infant. Now, it can also be defined as crying for 3 or more hours, for 3 or more days in a week, for 3 or more weeks. Episodes of colic start as early as 2 to 3 weeks old and usually peak when they are about 6 weeks old and decline significantly around 3 to 4 months old. It can sometimes last until 6 months old. How does a child with colic look like? I will list down some features of a colicky baby. Number 1, intense crying or screaming, or the baby appears to be in pain. Number 2, crying for no apparent reason. Number 3, extreme fussiness even after crying has diminished. Number 4, predictable timing with episodes often occurring around the same time. Number 5, facial discoloring such as reddening of the face or perhaps having paler skin around the lips. And number 6, a tense body such as pulled up or stiffened legs, stiffened arms, clenched fists, arched back, or tense abdomen. What causes colic? Nobody knows for sure what causes it. There are numerous theories, or possibly it's multifactorial. It's very difficult for researchers to pinpoint certain features of colic. Some theories suggest that some babies may just be more sensitive to stimulation, or they have difficulties in self-soothing, or their nervous system may not be mature yet. Some of the possible contributing factors that have been explored include maybe they have an immature digestive system, possibly they have an imbalance of healthy gut bacteria, they may have food allergies or intolerances, they may be overfed, underfed, or not enough burping. It could be an early form of childhood migraine, and there could be family stress or anxiety particularly in the parents. How does one manage a colicky baby? As mentioned before, colic usually occurs when it's around the evening time, just around the same time that the parents also finish their day's work and are feeling tired themselves. It's not the best combination of factors, isn't it? So you have a fussy baby and a tired parent. It's not the best combination. The baby's fussy period may sound like a torture to the already tired and stressed out parents. The number one tip for the parent to manage a colicky child is to remain calm. Babies can sense their parents' anxiety, and they do respond to that anxiety by perhaps crying more. So the best way is just to be calm about it. It was already mentioned that colic is very common and it occurs in healthy babies. Your baby just wants to cry out, possibly to relieve some stress themselves. Do not let their cries bother you to the point that you get angry and frustrated yourself. Now, I know that sometimes waiting it out for the period of colic to sort of tide over, but it's not the easiest thing to do, to wait it out while the baby is crying so loudly. So take a deep breath and try the soothing strategies that I will list down below. You may need to experiment with a few different strategies or try different combinations of strategies. Some soothing strategies may work better than others, and some may work one time but may not work another time. Just bear in mind that you have to try different things, okay? Some of the soothing strategies include: you may try to take your baby on a car ride or maybe walk around the house in a stroller. You may try walking around with or rocking your baby gently. Swaddling your baby in a light blanket may help as well to make them feel secure. Giving your baby a warm bath. Using a pacifier. Rubbing your infant baby's tummy or putting your baby on the tummy and rubbing his or her back. Playing an audio of heartbeat sounds, quiet soothing sounds, or just quiet music. Provide white noise by, you can turn on YouTube now. There's a lot of white noise sounds. It can be anything like vacuum cleaner humming. It could be your washing machine noise. It could be also rain sounds and ocean wave sounds. Those seem to help. Those help my baby as well to calm down. You can try dimming the lights in the room so that it's not so glaring. Try to limit visual stimulation, making sure the room temperature is a nice temperature, neither too hot or too cold. Some of the feeding tweaks that you can do as a soothing strategy is, if you are breastfeeding, mommy can try to eliminate cow's milk products, caffeine, onions, cabbage, or potentially other more irritating foods from your own diet to see if that helps. If your baby is formula fed, talk to your pediatrician about possibility of switching to another formula. Then perhaps a protein hydrolysate formula may help your child. Try not to overfeed your baby, which could make him or her uncomfortable. In general, try to wait about 2 to 2.5 hours from the start of one feeding to the next one. Burp your baby more frequently to avoid trapped air bubbles. Some studies have shown that probiotics can help relieve colic symptoms. You can talk to your doctor about this. Finally, you could also see your pediatrician to just rule out any serious medical conditions in your child. However, I can tell you most of the time, your baby is perfectly healthy. Occasionally, your doctor may prescribe an anti-colic medication to help relieve the gassiness. These medications are safe for babies. The next part is also very important. Caring for a child with colic can sometimes be very stressful for the parents. I would like to suggest some strategies to help the parents manage their own selves when taking care or when encountering a baby with colic. We know that caring for an infant is already exhausting and stressful in itself, but particularly if your child is also very colicky and crying a lot, that may be an added stress. So below are some of the strategies that you can take to take care of yourself, because you need to take care of yourself before you can take care of others. Number one, take a break. Try to take some breaks or let others help you out if you are feeling very stressed and tired. Take turns with your spouse or ask a family member or a trusted friend to take over for a while. Give yourself an opportunity to take a rest and perhaps leave the house so that you can calm yourself down. You could also use the baby crib, lay the baby down, and use that as a way to just give yourself a moment. It is perfectly okay and safe to put your baby in the crib while he or she is crying or having a colic period, just let the baby cry it out sometimes and give yourself some room. Number three, it is very important that you express your feeling, especially when you're feeling very stressed and tired. It is good to talk to someone about how you feel. You might feel helpless, depressed, guilty, or even angry. Share your feelings with someone you trust. You can even share it with your child's doctor. Do not judge yourself. Do not measure your success as a parent by how much your child cries. Colic is not a result of poor parenting. And your baby's cries also do not mean that your baby is rejecting you. It is nothing personal. Take care of your health first and foremost. Eat healthy foods. Make time for some light exercises. If you can, get rest when the baby is sleeping. Just try to get as much rest as you can. Alright? Try to avoid alcohol and other drugs. Remember that this phase is just temporary. Colic episodes usually improve by month 3 or 4. Lastly, have a so-called backup plan or rescue plan. If possible, make a plan with a relative or a spouse or a friend when you are feeling absolutely overwhelmed. So you call that person and ask that person to step in when you are absolutely at a breaking point, okay? You may also talk to your doctor or a mental health professional. Now, why is it so important that we focus on the parents' mental health or mental state? Why do we tell parents to be calm in the face of colic? This is to avoid a condition called shaken baby syndrome. When parents get too stressed or angry and upset when their baby is crying, sometimes they might feel an urge to shake the baby. No matter how upset you are as a parent, do not shake your baby under any circumstances. Shaking an infant very hard can lead to blindness, brain damage, and sometimes even death. Parents who are depressed or are having trouble dealing with your emotions, it is advisable to seek professional help right away to avoid harming yourself as well as your baby. Alright, lastly, parenthood is an ongoing process that sometimes seems like a roller coaster ride. Well, it is. Go with the flow and enjoy your baby. In a blink of an eye, they'll be grown up all too soon. So stay calm and be a peaceful parent. I hope you enjoyed the video and learned a thing or two from it. Stay safe and take care. Thank you. Bye.